Hello, everyone, and welcome to this Happy Hormones Day and Preventative Health Awareness Month and Movement. I'm Margaret Wallace Duffy, the visionary behind the Preventative Health Month, and I am beyond excited to be here this evening with a panel of amazing women and professionals who share a common vision and mission, and that's to educate and empower you to take control of your hormonal health at different ages and stages of life. You know, as an owner of an integrative health clinic for many years, one thing that I know to be true is working better together is critically important. And this mission is to stock your preventative health toolbox and give you as many options to consider when it comes to your health so you can improve your health esteem and find ways to advocate for your well-being for yourself and your family. So tonight, you're in for a real treat because we have a panel of professionals who have all kinds of experience, who believe in working better together, and who also believe in education and have given their time this evening for this panel. So I'm really excited to introduce a wonderful lineup. I'm just going to put my glasses on and make sure I read appropriately. Dr. Nicole Meyer from Cornerstone Health Center. And I got to say, I've lived in Georgetown for almost 14 years. And of course, Dr. Nicole's name is all over the place. We've talked to collaborations and things with Dr. Teskey, but I've never actually got to meet her in person. So just like all of you, I get to meet her this evening on this broadcast, which I'm so excited about. And welcome, Nicole.
Thank you.
Nancy Brooker is a menopause coaching specialist. She's an advanced EFT practitioner and a life coach. And to be honest, she is working tirelessly behind the scenes, executing and helping us make this grassroots campaign come to life. So Nancy, welcome.
Thank you. Happy to be here.
Marissa Sylvester from Marissa Sylvester Wellness is a holistic nutritionist, a fitness professional, and a huge ambassador, contributing all kinds of education all month long and all year long to our preventative health movement. Welcome, Marissa. We just did something on bone health together, and now you're here doing something on hormonal health.
I'm happy to be here. Thanks, Mark.
And of course, last but not least, Merle DaCosta, who is a registered physiotherapist and clinical manager of Aramosa Physio. Welcome, Merle.
Thank you. Nice to be here.
All right. So why don't we dive right in right away? So we're going to sort of set the stage and first start to talk about sort of the, menarche, the early days of hormones and fertility, kind of those early days. And what we've done is we've taken a lot of your frequently asked questions. And of course, we know there'll be so many more, and that's why we're going to have a live event. But we're going to look at some of the frequently asked questions and try to stock your toolbox. So the first question actually for Marissa, why should we track our cycles? And what benefits does that have to offer?
It's a loaded question to start with, Mark. Okay, so whether you are menstruating or not, it's important that we as women track the different symptoms that we feel over the course of each month that we're alive. So if we're talking about this as it pertains to fertility, we need to teach, the next generation of women once they start menstruating that they really need to have a deep understanding of what their unique cycle looks like, because what my period it looks like, it may be very different from what Dr. Nicole's menstrual period looks like, or what Meryl's looks like, or what yours looked like, Mark, right? Or Nancy's for that matter. So everybody needs to have a deep understanding of the different changes their body undergoes throughout the month or their unique cycle. Okay, so generally what we're looking to see is that we're meeting these 4 phases of our cycle, right? So our menstrual phase, our follicular phase, our ovulatory phase, and then our luteal phase of our cycle. And so you can get lots of information on when those specific cycles occur within your menstrual cycle, but it's important to understand that as women, our hormones ebb and flow throughout the month, and it creates these phases of menstruation that we need to understand that help to determine the benchmarks of our period health. So for example, you want to make sure that around between day 12 and day 16 of your cycle, you're noticing symptoms of ovulation, right? So ovulation is very, very, very important, not just for fertility health, but it's actually one of the vital signs for our health as women. So it ties into our heart health, our bone health, our mental health. So your period isn't just telling you whether you can get pregnant or not. It's really a vital sign, just like your body temperature, your respiration rate, and your pulse, right? So you want to make sure that between day 12 and day 16, you're having ovulation. So different signs of ovulation could be a change in energy. It could be a change in the mucus that you have as a woman, right? It changes to more of like an egg white consistency when we're ovulating. You can get, slight cramping, pinchy pains, things like that. Those are just some very common symptoms of ovulation, right? So you want to make sure that you're kind of mapping what your menstrual cycle looks like throughout the entire month. Do you have periods of restlessness? Do you get irritable, moody? Do you get headaches? Do you get cramps 5 to 7 days before your period? Are you getting cravings, 7 to 10 days before you menstruate? Does your sleep change? Does your ability to exercise in certain ways, does that change over the course of your cycle, right? So we really want to track our cycle every single day to make sure that we have a deep understanding of what's happening from month to month. And I say that you want to track your cycle for at least 3 months so that you can start to see some trends and patterns in your cycle. And maybe that's the length of your cycle. Does that change, or are you pretty standard at getting your period every 28, 30 days? Do you see signs of ovulation around the same time? Do you notice dips in energy around the same time? Do you notice changes to bowel movements around the same time? We just start to really notice these trends. So 3 months as a minimum to be able to, get an idea of what your menstrual cycle looks like.
Thank you, Marissa. And both as a massage therapist, but also as a woman that had severe endometriosis as a young girl and went over 10 years not being diagnosed. What I love about what you just said, and what the whole reason we're doing Preventative Health Awareness Month, is really making people listen and be aware of their bodies. They are the CEO of their health. And by tracking things, what we track, we notice. Yes, we can see trends, but even from the perspective of you as the woman, you start to notice and feel things, and that can lead to empowerment, because when we know things, then we can have those conversations to advocate with our healthcare team. So thank you for that, because that was really, really important. Did anybody else want to add anything to that before we move on?
I think
That was
that was excellent. I think the nice thing too is that I think our technology has made it really easy to track our cycles now too.
Yes.
So if you've got a Garmin watch, a Fitbit, there's also the Flow app, right? So like I said, you can definitely track all of your symptoms because, like you said, Mark, it takes a long time for women to get diagnosed with certain things. And so if you've got that data on hand, you can take that with you if you are having issues to your family doctor as well.
Exactly. Or your naturopath, right, Dr. Nicole?
Your functional medical doctor.
Therapist or your physiotherapist or any allied health professional. But I notice that young women often don't track, and they'll come to me with concerns, but they can't tell me the details of when they last had a period, how heavy their period is, when their symptoms occur. And so it is a little bit difficult for us to help when we have that information, because like Marissa said, those patterns, those phases of your cycle are pretty critical. So, there's a lot to be done about menstrual irregularity, menstrual pain, all of the things that happens to young women. And in terms of getting a diagnosis of something like endometriosis, I recently read a paper that if you are under the age of 25, it can be up to 15 years before you get a diagnosis.
Mine was about 12. And at that point, it was on my bowel, on my lung, on my, serious illness. I mean, that's why I'm passionate about what I do and why I started my career in the first place. So great answers and great education. So that let's move on because we got a lot to cover. Dr. Nicole, what can be done to help? And I know this is a loaded question too, and once again, what we're saying here, of course, you want to check with your healthcare professional. This is for educational purposes only, and to start thinking so you can advocate for yourself. We're not giving medical advice here without knowing your personal situation, but what can be done for menstrual cramps in teenage years and even in perimenopause?
There's a lot that can be done for menstrual cramps. I think that there's different ways to approach menstrual cramps. So the details do matter. Marissa made a comment about having cramps before your period comes versus having cramps when you're menstruating. Those are sort of two different animals. There's a physical structural component to menstrual cramps that I think is very important. Your pelvic health can really play a role here. There's if there's endometriosis or some other concern, then we have to sort of get to the bottom of the impact of that on the pelvis itself and the organs in the pelvis. But in terms of what can be done for most of us, first of all, sort of understanding. I've always really strongly had the opinion that first of all, we never dismiss young women when they come to us with concerns of menstrual pain.
Yes.
Gauging the severity of that pain is important. I've always believed that women, we have this incredible system, where hormones change really dramatically. You're going to probably notice it. So I don't think the goal is to not notice it.
Right.
But I do think the goal is to not be impacted to the point where you can't go to work or you have to take strong, medications, or you can't go to school. That's a problem. That's too much pain, and that shouldn't be happening. So diet plays a role. It plays a really big role. Inflammatory diets can drive up a marker in your blood that's very specific to menstrual cramps called interleukin 6. And so we know that diets that are high in saturated fat and high in processed carbohydrates will contribute to menstrual pain very directly. There's also deficiencies in people's diets these days, like magnesium is a easy one. When you have a magnesium deficiency, cramping is more likely to happen. So certainly there's an awful lot that can be done. I haven't touched on acupuncture. I haven't touched on herbal or nutraceutical remedies that could help with menstrual cramps. And though there's a million of those, there's a lot of options. Yes. So exploring those, I would just encourage moms of young women. In Chinese medicine, it's believed that if the menstrual cycle is painful from the beginning or close to the beginning, you have to get on it really early. You have to manage it really early. And leaving it until you're 18 or 19 or 20 years old just makes it more difficult to manage it with natural strategies before you have to get into drugs to manage it. So if a young person is suffering, please, bring them to someone who can support that. And by all means, have the blood work done, have the studies done that you need to have done at your doctor's office. If the only option is the oral contraceptive pill, I think you should look at your other options.
Mm-hmm. Yes. I get emotional even hearing you say that, because I was that little girl that no one listened to.
So was I. Yeah. With terrible.
Terrible. And my parents advocated I was a competitive athlete and was called everything from an only child with a hypersensitive stomach to a competitive athlete with a nervous stomach to a drug-seeking teen, because all I wanted to do was I just wanted to be with my peers and doing what everybody else was doing. And I was so in so much pain. And if I'd known, years later, 40 years later, it took to get a national strategy for endometriosis in this country. And this is why this is so important to me. And having, this conversation to help others earlier on is so important. It makes me tearful, because you're right. You go years without it and people suffering, and then it's harder to get back on track. And when I think about pelvic floor, Merle, this is right in your wheelhouse. And I wish I had had that years ago to help me, because I know it would have made a difference.
Yeah, and we definitely see a lot of increase in pelvic tone, abdominal tone as well. So really helping kids navigate what's happening with the muscular system is really important. Teaching them about when to use constructive rest, we call it, and then movement, actually, because sometimes when we're in pain, we stop moving, and movement is so important. Now, we're not talking about going and running 5 kilometers, but general movement in and around the abdominal region, the back and hips, is also really helpful. A TENS unit is a unit that we use for pain, can also be very helpful when kids have a lot of discomfort, because it's another way to dampen the symptoms too. Not kind of disguise the symptoms, but just help them manage the symptoms.
Yes, and right in the wheelhouse, right with you as a massage therapist and kinesiologist. Massage therapy, I've treated so many women and dealing with musculoskeletal pain during menstruation. Similar to the TENS, there's something called, that I'm highly trained in, microcurrent point stimulation therapy, or otherwise known as the dolphin, which literally down regulates the autonomic nervous system, reduces cortisol, inflammatory markers. And it's a game changer. There's a vagal nerve clip that you can use. It's a game changer in pain management. And then one thing that a lot of people don't know, there's a lot of kinesiology tapes out there, but the one that I love to use, and actually the company's mission, is to reduce the amount of analgesics that young women have to take with their menstrual cramps, because their kinesiology tape, it's called mobility tape, is infused with menthol, and I've shown women how to tape their abdomen during menstruation or their low back, so that they can get relief, they can continue with their life, they can go on that walk or do that light activity instead of lying, which makes matters worse. And these are all the things that are in our toolbox that we often don't know. Hydrotherapy and all kinds of things. That's why you got to come to the playground event, because you're going to be able to touch, feel, and try that in May. Marissa, you look like you need to say something.
No, I was just going to add too, like one of the lower cost barrier, like, ideas that I give to my clients is the use of castor oil. So castor oil with heat on the abdomen is really effective at downgrading inflammatory markers, and it's a fantastic detoxifying agent. So, and it helps to relieve pain. So, and not just period pain, but just pelvic pain, back pain, liver dysfunction. Like, we use castor oil for many, many, many things. So if somebody's looking for something that's quite cost efficient to bring into their toolbox, and I love the use of castor oil with heat, and see how that works for you. Hot water bottle or a magic bag, and 30 to 40 minutes on a daily basis, and you can really notice a lot of difference just by using straight up castor oil.
Yes, and you could implement and layer that with clinical essential oils, which can make a difference too. And that's something we'll be talking about later.
Sure.
Okay, we're going to move on because we've got more to cover here. So Nancy, as a menopause coach, and we all know that we cannot avoid stress. It is part of our daily lives. How does stress affect our hormones, and what symptoms can we sometimes see as a result of stress related to hormones?
Yeah, so I think it's interesting when we think about hormones and hormone imbalances. We often forget about cortisol, which is the stress hormone. We're always thinking about estrogen and progesterone and all these other things that are happening, which of course matter. But the level of stress that we have in our lives, and the sort of prolonged elevated cortisol periods that we're going through because of all this stress, it's really wreaking havoc on all of the other hormones in our body as well. It's interplaying with their estrogen, our progesterone, our testosterone, all of our hunger and fullness hormones, our melatonin, our ability to sleep. Everything is being affected by the cortisol being high. And of course, we need cortisol in our bodies. It does a lot of good things too. Um, it's that survival sort of hormone that kicks in when we feel a threat, and we need to be able to fight or flee our way out of something. It mobilizes our body to do that. And it helps to reduce inflammation. It helps to regulate our sleep cycles. It helps with our regulate our blood sugar, our blood pressure, all kinds of great things. But we have to be careful. We have to be mindful of those stress levels, because when we have that a threat, we process it and we go back to a baseline, a balance. that it's doing its job. But when we're creeping up and creeping up and creeping up, and we're not dealing with those underlying stressors, we're affecting so many different areas of our lives, and so many other hormones are being affected by that. They're all interconnected. And so then we can start to feel that brain fog. We can start to, have the weight gain, the hot flushes, the mood swings, the muscle pains, all of these other things that come along with these hormone imbalances in our body. So it's really, I really just wanted to make sure that we stress the importance of managing our stress,
Yes.
and the importance of that interplay between the cortisol and all of the other hormones. And so I think we're going to talk a little bit later on about some ways to deal with the stressors in our lives too.
Yes.
But and so many great ideas are going to be coming up. To talking about exercise, talking about nutrition, and bone health, and all of these other things that can help to manage the stressors in our lives. Yeah.
Excellent
But I
point.
wanted to say, when we were talking earlier about all of the ways to manage period pain and that sort of thing, I wish there had been, like, I remember it was a hot water bottle. That's all you had, right? And you put the hot water bottle on your belly or wherever it was that was hurting, and that was all you knew. And it wasn't really talked about, and there wasn't really somebody to go to and to get information from. So, I have boys, I don't have daughters, but I'm so grateful that the next generation coming up is going to be able to see something like this and get this great information.
Absolutely.
It's more
Thanks.
than the hot water bottle.
Yes. So Marissa, what are some of the exercise practices, and Merle, you might want to hop in here as well, through the different phases of menstrual cycle? So, we don't need to go into great detail, but just as we were talking about, and Merle alluded to, there's different types of exercises that are better at different times. Can you speak to that?
Of course, yeah. So just like I talked about the phases of our menstrual cycle, our energy, our ability to influence our metabolism, it changes as we go through the phases of our cycle and over the course of our month. So, for example, in your follicular phase, so, kind of 5 days in, you've finished menstruating, until about day 10 or 12 into ovulation, you have this surge of energy, right? This is when estrogen is high. You feel like you can tackle the world. You want to do all the things. So this is when, if you were going to do more of your high intensity interval training, or a little bit more cardiovascular exercise, that's when you want to do that kind of activity, because you have the energy and the hormones to support you during that time. On the flip side, if we look post-ovulation into that luteal phase, you're already going to notice that your energy is lower, right? Because your body is doing more. Your body's actually calling on more cortisol during that time. So your body's in a little bit more of a stress state to begin with. And so if you were to go and do a lot of cardio, kind of in that last, in the luteal phase is the longest phase of our cycle, that last, 14 days before we menstruate, then you're going to find that you might get more bloating, you might have more cramping, you might be more tired, you're not going to be able to assimilate your muscle mass quite as efficiently as you would at the beginning of the cycle. But I do say you gotta move, right? So I like Pilates. I like Pilates right through the cycle. It's excellent because it doesn't elicit too much cortisol. We're not jacking the heart rate, but we're lifting weights and we're using the body in a functional way to really help to stimulate factor 1, so insulin factor 1, so that you can properly assimilate muscle mass, right? Lower your blood sugar, have better rates of assimilation of nutrients, and burning glucose for fuel, right? So I love Pilates. I love weight training for that. And then during the end of your cycle, I want you to do more things, or during your cycle, so when you're actually physically bleeding, that's when you want to do things like walking and yoga and gentle Pilates and things that are more nurturing. Massage is great to do during that time. You really just want to create an environment of calm in the body. So it doesn't mean that you're not being active. We're just using the ebbs and flows of energy to really help to assimilate our metabolism, be able to burn fuel effectively, be able to create lean muscle mass, and to make sure that we're not stressing out the body to a point where it's impacting our ability to have a healthy menstrual cycle.
Great.
Yeah. And I don't think it's wrong to do activities that can stress the body. I think it's also important to make sure that sometimes during those periods, you've also added in recovery periods, right? So, during those times where maybe you are under a little bit more stress, sometimes I like to add in mobility days, or maybe I add in a yoga day, or, instead of going for a longer run, I may have to add a walk. Right. Just like I said, the recovery days and recovery periods are really important. And especially when you're talking to athletes, because, we can't actually, really decide when a race falls, or, when we have an important game, right? So you have to kind of moderate your exercise and training to kind of listen to your body. But like I said, don't feel bad, if your period's going to happen on that big race day. Maybe it's some, you've got some recovery periods that you're going to, plant before that race and maybe after that race as well.
Great point, because we are, like you said, there's inconvenience times in life and we have to still live. And so that's great point, Merle. I really appreciate you saying that. So can we continue with you, Merle, and talk about some of the common but not normal pelvic symptoms that women would get? So how do we know what is normal or when we should be concerned?
Yeah. So I think one of the biggest things that we see is a lot of women will have urinary incontinence as well. And I think it actually almost becomes a joke, especially as we age, right? Or after we've had babies, and as we age, it's like, oh, I peed my pants after I left, or after I jumped, or, people aren't starting to jump. So it is definitely very common, but it's not normal, right? And it's not normal even as we age, even in a nursing home. Okay, so definitely that would be one. Fecal incontinence, we don't necessarily talk about that, but that is, again, is quite common, but not normal. Pain with sexual intercourse, typically we see it after we've had babies or as we age. So again, not normal to have it. Don't let your doctor tell you just relax before you have intercourse, because that again is not normal. Overactive bladder symptoms. Sometimes when we're having to go to the washroom frequently, you've just gone at 3:00 and at 3:30 you feel like you need to go. Again, so again, not a normal symptom. Pelvic pain and pelvic pressure as well. So again, after, say you've been running and jumping, if you've got a lot of discomfort, and sometimes chronic low back pain and SI joint pain, that just doesn't resolve. Sometimes there's a pelvic health component to that as well. So seeing a pelvic health therapist can be helpful. It's another way to resolve those symptoms. We know about 70% of women with low back pain will have a pelvic floor issue as well.
And I so relate to this. I don't know, Dr. Nicole, whether you had this or not, but my endometrial lesions were also on my uterosacral ligaments, and the amount of back pain and pain pressure into my pelvis for years, and it was never once. Now, I had a pelvic floor physio in my clinic when I had it, but for that reason, it was never suggested to me. And I think when we talk about painful intercourse in young women, I think sometimes too, they're embarrassed to speak about it. They're embarrassed to admit that this might be something that's wrong, or they think there's something wrong with them, and therefore they go quiet and their sexual health is impacted, which is also not healthy, because that can impact relationships, that can impact your mental health. So thank you, Meryl, for saying that. And really, talking candidly here really helps women give them permission to be vulnerable and to ask for help and to advocate, to say, well, no, actually, this isn't normal, and I need help. Yeah. Okay, so let's just one very quickly, Marissa, because I know this could be a whole webinar on its own. What are some nutritional strategies to support hormonal health at any age and stage?
Yeah, so I think it's very important for women of all ages and stages to eat whole food. So we really need to go back to grassroots eating and understand that whole food is the best source of nutrition for our body. So we need to stop buying prepackaged food, fast food, and really go back to eating fruits and vegetables and nuts and seeds and animal proteins and plant proteins, because those are going to give our body all of our vital macronutrients, right? Our proteins, our fats, our carbohydrates, along with our micronutrients, our minerals and our vitamins. So the more we can teach our young to eat whole food and to prioritize eating whole food in the home, the better you're going to support your young woman's segue into their menstrual cycle and have overall better outcomes for hormone health. So number one, we just got to eat whole food. Number two, I think that protein is incredibly important for women to understand as a vital nutrient. We need it to create every single cell in our body, right? Amino acids are precursors for the building blocks for our cells. And if we are underfed in protein, it's going to impact every single function in our body, right? So, everyone should be striving towards I would say at least 1 gram of protein per kilogram of body weight at minimum. I like to say for, women that are past their pubescent years, you look at your healthy weight. Okay, so if you're a 120-pound female and you're active, then you want to try and eat about 100 to 120 grams of protein per day to help support your hormone health. And that will, it gives us better outcomes for our blood sugar. It reduces cravings. It helps us to better assimilate our muscle mass. And then as we get older and we start to lose, right, our ability to maintain our muscle mass, then your protein's going to step up and it's going to help you keep that really healthy BMI as you age.
Excellent. All right, thank you. Okay, we're gonna transition into perimenopause and the menopause phase. And Dr. Nicole, I'm sure you see this on the daily in your practice. When it comes to the one thing, of course, in the culture that we live in, everybody's worried about the way we look. And the one thing that often shows up in perimenopause and menopause is that whole thing about weight gain and the question of, oh my gosh, what do I do to lose this weight? Am I wrong in saying that that's probably something you hear all the time?
Yeah, no, I hear it a lot. That is very true. I would say I even have gotten to the point where I start to warn women in their 40s that sometime in their 50s, when they become menopausal, they're going to see some changes in their body. And I don't know that that's true for every woman, but I would say 9 out of 10 women would say to you, my body feels different at 55 than it did at 35. Just kind of like, your body felt different after your babies. If you had them, there were changes. They weren't necessarily bad, but they're different.
Yes.
And I remember watching my daughter grow up, and I could tell when she got her woman's body. If you have daughters, you probably know what I mean. It's different.
Totally.
Right? It's not their teenage body anymore. So, weight gain in perimenopause and menopause is a perfect storm, I think, and Nancy can answer this question a little bit too, of what's going on in your life at that time. So if we think about our 40s and our 50s, we have aging parents, we have teenagers, we're usually at peak career, right?
Yep.
So there's a lot going on. So it's very tied into cortisol dysregulation. And as cortisol goes up, so does body fat, because your body is perpetually in an emergency state. It's trying to protect its organs. It's doing it's adaptive. It's doing what it should do, which is pad you up around the middle to protect your organs. As we get into our 50s, we'll see body fat becoming an estrogen reservoir. So when your ovaries are not signaling, they're not producing estrogen anymore, sometimes body fat can be the reservoir of estrogen for perimenopausal and menopausal women. So with the change in life, when you become menopausal, when your period stops, it can put an additional demand on some glands in your body called adrenal glands, because those glands pick up the job of producing some of these sex hormones that are no longer the ovaries' job. The ovaries are like, done, did my job, somebody else can clean up this mess. And with that comes the elevation in cortisol and comes some of the body fat increases. So, the solutions are varied, and there's a lot to talk about there. But when stress hormone goes up, blood sugar starts to wobble. Insulin will come up. You can get insulin resistance. You can have trouble with other hormones of satiety, like leptin. So it's a complicated physiological process, but it is something that if you're eating whole foods, if you've got some support around your teenagers, your aging parents, your ridiculous career, it's going to go a little better. And exercise as a stress management tool and an outlet, and whole foods as a rule at home is going to go a long way in managing that change.
Yeah.
But also, it's okay to change a little bit.
Yes.
I joke with menopausal women a lot that you don't have to be the weight you were in high school.
Mm-hmm.
Isn't that the truth?
If your body mass, I don't care about body weight. I care about muscle to fat ratio. If you're strong and you're 10 pounds heavier than you were 10 years ago, but your body fat is 24, 25%, and you're 50 years old, you're great. You're metabolically healthy. Don't worry about it.
Yeah.
Buy bigger pants.
Yes, don't keep going into that closet to get what you wore 15 years ago. But that's the images that that women are seeing on a regular, and being strong, like you said, and healthy is what we should be striving for. That was an amazing answer, and I know that at the upcoming event there'll be more that we can talk about with that. Now, of course, this is a perfect way to transition into a question for you, Meryl, because certainly I've went through menopause at the age of 39. I'm now 56. I'll be 57 in May. And muscle pain and issues with the musculoskeletal system often go hand in hand. So perimenopausal women are at risk of tendon injuries, shoulder, of course. I've seen this a lot: plantar fasciitis, tennis elbow, Achilles, the gluteal area, sciatica. Why is this? And what can we do to both prevent and or address these injuries when they happen? My practice has been full of this for years. Meryl, I can't wait to hear your answer.
So, and I think it's the change in hormone levels, actually, because we've got so many estrogen receptors throughout our bodies. So what happens is, as estrogen declines, our muscles become weaker, right? So we actually start to lose muscle mass in our 30s at about 1 to 2% a year. But when we hit perimenopause, it actually escalates to about 5 to 7%. Right. So we definitely start to lose a lot of muscle. Tendons also have lots of estrogen receptors. So when we lose that estrogen or it declines, the tendons actually become stiffer. So then you've got this muscle that's contractile that's pulling on a tendon that gets stiffer. So we typically then start to notice more injuries in shoulders and the Achilles, the glutes, the back. As a result of that. And I think that combines with what Nicole says, because sometimes we start to notice that increase in weight gain. So then we start to do more activity. And in our 20s, you'd go run a 5K and, the weight would drop off. But now we can't exercise the same way that we did. So we need to make sure that we're gradually increasing our activity, because a sudden increase in activity can cause those tendons to get irritated. Also, how we rehab our tendons now is a lot different. So, we used to do a lot of eccentric work with menopausal women and perimenopausal women. We know that they don't tolerate that initially. So we may need to start isometrically. We have to change how quickly we progress activities and exercises, which is very important. So like I said, it's the combination of that muscle mass change, but also the tendons getting stiffer. Things that you can do for it, though, is definitely gradually increase your activity. At this age, Pilates is fantastic, yoga is excellent, but we need to be resistance training. So the only way that we can actually build up that muscle is actually to lift heavy weights, right? So again, being able to progress that is going to be important. And with that will come body changes, but hopefully positive body changes, because you'll be putting muscle mass on. right? And it's about longevity. So though your exercise program should have heavy resistance weights where, you're lifting say 6 to 8 repetitions, but not just the 5 pound weights that we used to do for 20 repetitions. It's got to be progressive. You want to make sure that you're targeting various body parts. That's going to be important. And then having the recovery time too. So making sure that you've got 1 or 2 days of recovery so that those muscles and tendons settle down as well. So that's where you could add a Pilates or a walk or a yoga as well. Sleep is also really important. So at this time, our sleep starts to go awire as our progesterone changes. So we want to make sure that we try to get sleep back on course. So, again, chatting with other healthcare professionals, making sure that you're eating well is going to be important here too, because that's all part of your recovery as well.
Absolutely. And, in hydration, when we're thinking about muscle, dehydrated muscle develops trigger points easier than hydrated muscle. And when we think about inflammation in the body, that's critically important in the use of hydrotherapy to help in that recovery phase. So there's many things we can do. And something I just wanted to raise, because it is a bit of an empowerment and helps. I mean, we recognize that sometimes it can be overwhelming. What do I do? I don't know where to start. Often look also into your community and into your healthcare plan. If you actually have extended health insurance, it's much better than it used to be. There is nothing wrong with booking to go see Merle or a physiotherapist in your community to actually talk about you and what you can be doing to keep yourself safe, or to a massage therapist that's trained not just to passively treat you, but with remedial exercise, or to Dr. Nicole, to a naturopath, or to Nancy, or a nutritionist. Think about the resources you have in leveraging those. You need to use your team. You're the most important member of that team, but sometimes lean in on. And the more we speak about wanting that kind of coverage and need for that, prevention, what we do today is going to have an impact on what we can or cannot do tomorrow. When we talk about muscle health, move it or lose it is true. But sometimes the barrier to access things or the fear of not doing something right, people don't do it. So look into your insurance as well. And of course, that's why we're doing this Preventative Health Awareness Month. And it's all year long, free education so that you can feel confident and asking for help. Anybody else wanted to add to that before we move on?
I just think it's important to talk about assembling your health team, right? So
Yes.
clients come to see me and I'm like, okay, I'm the first piece of this puzzle, but who else are we going to bring into this circle to help support you in a very comprehensive way? I think that, we used to go to our family doctor and what they said was law, and we didn't really ask questions outside of that lens. And I think that especially as women, we need to widen the lens for which we advocate for ourselves and our health. And if you're not getting the answers that you need to assemble your health team. And I think that we need to look at it as an investment in our overall wellness. So yes, we can lean on our health coverage when we have it, but also just like you would invest in your favorite handbag, invest in your healthcare professionals.
Totally. Okay, we can't talk about perimenopause and menopause without talking about hormone replacement therapy. And over the years, there have been different views on this topic from, the research, and things have certainly changed. But there is also a lot of fear around it for some people. Dr. Nicole, could you speak to the role that hormone replacement therapy has? Is it safe? And what is the latest research on that topic?
Most of the people here on this panel are old enough to remember about 20 years ago when the Women's Health Initiative study hit the news, and every woman in North America came off her hormone therapy overnight.
Yes.
Right. And so the argument is what we've been left with in that wake is a epidemic of osteoporosis.
Yes.
An epidemic of cognitive decline, and potentially some other things that are arguably related to hormones like heart disease. So when that data, that giant study that made it look as though, or appeared that women who took hormone therapy were more likely to get breast cancer, when that was published many years ago, it turns out that the women were over 60 and the hormones that were initiated were started in a woman over 60. So there's a big problem with that. We don't start women on hormones typically when they're 60. They're 10 years past menopause, or 7 years past menopause. That is a time where your body has sort of settled in and gotten used to not having the hormones. You're not supposed to have the hormones of a 20-year-old when you're 65. So hormone replacement therapy has risks. It has a lot of benefits. It is not risk-free, but taking a Tylenol is not risk-free, and crossing the street is not risk-free. So the idea is to be informed of the risks. If you've had cancer, particularly a hormone-dependent cancer, breast, ovarian, uterine, then you are not a candidate for hormone replacement therapy. If you have a first-degree relative like your mother or your sister who's had breast cancer, you're probably not a candidate for hormone replacement therapy. But there are great screening tools that any trained family doctor or naturopathic doctor who can prescribe hormones, certainly a gynecologist, will walk you through to see if you're a candidate. There's so much opportunity in the first 5 years after menopause to soften the blow of menopause. So the drop in estrogen and progesterone is so dramatic in that first 5 years that you can lose massive amounts of bone. The steepest cognitive loss that you will have in your life is 5 years after menopause. Your cognitive function can tank. And when I talk to women about this, I remind them, if they ever were pregnant, remember your mommy brain? You remember after pregnancy, you're like, who am I? What are we doing here? You have, that drop in hormones post-pregnancy was dramatic, and it really affects your cognition. So there are gentler and softer ways to do hormone replacement, and there are also non-hormonal options that work reasonably well. Mm-hmm. What we don't ever want to overlook are the lifestyle things that make the menopausal transition so much worse. Caffeine, alcohol, stress, workaholics, all of the things in your life that will make you have more hot flashes and make you gain more weight and just really make you feel like you're unbalanced. Anxiety, depression, all of these things can come up. So there's a lot of ways to manage the menopausal transition. Hormone therapy is one of them. It needs to be done responsibly. I still occasionally get women that come into my office who've been on oral estrogen therapy for 10 years and haven't had anything checked by their physician. So we still see a little bit of that, cowboy prescribing out there, and that's unfortunate. But I think with the new guidelines and with the new screening tools, we can prescribe really safely for up until you're about 60 years old. If you're concerned about bone loss, cognitive decline, or your hot flashes and your symptoms are unmanageable.
Well, I saw, and Dr. Christy Prowse is contributing to Hormonal Health Day, the medical clinical director of the Institute for Hormonal Health. And I saw her at the age of 42 really struggling in early stages of menopause. And, adrenal fatigue, yep. But bioidentical hormones, I have to tell you, it was like someone turned a light back on. Mm-hmm. Now, my body has changed and I do feel differently, but there was a dramatic difference in the way I was feeling.
And that's really important, Margaret, because if you stop menstruating before the age of 50, you should really, really talk to somebody about having some kind of hormone replacement therapy, because it's a little bit too young, and the opportunity for you to lose bone and all of the things that can happen is greater. If our average lifespan as women is around 82, 83 years old, that's a long way to go without any hormones. So certainly if you become menopausal in your 40s, you absolutely need some support.
And what's crazy about that is that I found Dr. Christy Prowse on my own. It was never mentioned to me. There was no discussion with my doctors. I was just told that I was, they told me I wasn't going into menopause when I knew I was. My mother went through menopause at the same age. My aunt was younger, and I knew my body. But not only did they not want to hear that, there was no discussion, zero on, bioidentical hormones. I sought out Dr. Christy Paus myself, and I will say the change was dramatic for me. And that's why I'm so passionate about sharing this. So you're right. And I'm also passionate about bone health because of the work that I do in bone health and bringing the new REMS bone scan to Canada, where we're not just looking at bone mineral density, but both bone quality. And I'm osteopenic. Now, I think because of that, but also because of the medications that were prescribed to me because of endometriosis against my will many years ago. So knowledge is power, and I want to share this information so women behind us can speak up and have more information so they can challenge their doctors and be more informed to make better decisions.
Well, and you know, I'm always cautious. I don't want to doctor bash. You know, I'm a member of the Institute for Functional Medicine. I work with physicians every day. They all got into it for a great reason. But
absolutely.
I say this a lot to people. You don't ask a plumber to do your wiring. You know, you have to understand what to expect when you go into that office. You know, there's a scope of practice. There are things that they're supposed to do legally and that they're required to do and recommend. And then, so if you're not trained, why would you go to your doctor, your family doctor, for nutrition advice? It makes they don't have any nutrition training.
Zero.
Limited. Why would you go to them for help with your incontinence? Well, I suppose you could be screened. You get an ultrasound. You can make sure you don't have bladder cancer or something like that. But are they going to help you? Are they going to teach you how to use your pelvic muscles so that you don't have incontinence anymore? Of course not. So we have to manage our expectations, you know, and that's the building the healthcare team business, right?
Absolutely. And I couldn't agree more. My clinic was 80 to 90% doctor referral. I believe we're better together. You will never hear me use the word alternative medicine. We're complementary and we all work together. That being said, I think there's been a mentality that we go to our doctor, fix me doc, and there's still some, and I've got many friends that are doctors, and I'll push back sometimes because there's this fear to, and they think it's challenging a doctor to ask questions, or they get told, well, I just treated a patient last week who was told, what are you, Dr. Google? By her physician. No, she was trying to be informed and trying to be an advocate. So I totally agree with you. And I think there are many amazing doctors. Many of them referred to my clinic and continue to. So you're absolutely right. We're not here to bash any doctor, but we are here to educate so that you can figure out who's on your team, which is so important. Okay, so moving on. Merle, just lastly, and we're going to get into postmenopause. Many women experience pelvic health postpartum and during peri and postmenopausal transitions. What causes these changes and how can they be addressed? So you talked about it with the period, but now we're in this phase.
Yeah. So with that postpartum, there's also a decline in estrogen, and especially if they're breastfeeding, right? Which is very similar changes to what happens when we're in perimenopause, right? So as the hormones start to fluctuate, we've got lots of vaginal receptors within the actual pelvic floor area. So what happens is our tissue in the vagina will actually change. So instead of, I like to say it's like an accordion under normal circumstances. But what happens is that tube starts actually to become a little bit stiffer. So sometimes we can have discomfort with sexual intercourse. The tissue becomes a little bit more fragile. So not only does the vulvar tissue, but also the vaginal tissue becomes a bit more fragile. So we can have some bleeding when we're having intercourse. The capacity of the bladder also changes, so we can develop overactive bladder symptoms. And then we can also, again, because those muscles become a little bit weaker, we can start to develop incontinence, both urinary and fecal incontinence. So, we definitely want to make sure that we're getting that treated, either by seeing a pelvic health physiotherapist so that we can learn how to support the tissue. The pelvic floor training will help to increase blood flow to that area. We want to make sure that we're also examining. Something we don't talk about is examining your vulva, right? How many of you checked your vulva and to know that if there are changes to it that you need to go see your family doctor, right? So it's really important. So that's what I do with my clients is that, have you ever checked it? Let's look at it, right? Let's learn about it, because the last time we usually have had, any sort of training in that is way back in grade 5, right? And then so we don't know what's going normal and what's not normal. So like I said, it's really important that they learn what the changes are and what can change, and what you can do to prevent it. So, the pelvic floor exercises are really important. Also looking at, we talked about nutritional strategies. We now know that your bowel and bladder also have a microbiome, but so does the vaginal canal. So we want to make sure that we're eating well. At this time, because estrogen declines, our pH in the vagina also changes, so we're a little bit more susceptible to UTIs. So we want to make sure that we develop some support there. And lots of different things that we can use to support our vaginal and vulvar health. That includes, the use of moisturizers. There's a lot of good research right now looking at moisturizers that have hyaluronic acid in it. Local estrogen is also very helpful as well, because it works locally on the tissue itself. It's not going to get into the bloodstream, but that can support not just the vaginal canal, but also the vulva area as well. Exercise is super important. So not just pelvic health exercise, but just exercise in general will also help support the tissue too.
Excellent. Thank you so much. Nancy, postmenopausal or all through the stages, you've got some things in your toolbox as a menopause coach and as an advanced EFT practitioner that I know has helped me and helped so many of my patients. Can you speak to what are some of those things that are at our fingertips, some of the other stressors, and what can we do?
Yeah. So it can be such an take such an emotional toll on us. There are all these physical things happening, you know, until you go through it when you're not sleeping and you're having these hot flashes and you're not remembering things. You're really frustrated with yourself. Your body's changed. It's not working the way it used to work. Things that worked before aren't working anymore. And what I hear a lot from women is that they feel like they've lost their confidence. They feel like they feel very disempowered, like they have no control over anything anymore. And it's really difficult for them, and we have so many, and we're dealing with all the things that we were dealing with before in our lives. But now we've got all of these other things happening, and we're going through this stage where, like Nicole said, we've got we're empty nesting. We're taking care of our parents. We're into that point in our lives where we're losing people that are important to us, that people are getting health diagnoses. And our relationships are changing. It's a time in our life where, I think the pause is very important in menopause. It's that opportunity to stop and really take stock and think about, okay, what is it that I really want? Who really am I? How do I want to be going forward? And then to move on that. But it can be hard to do when you're feeling so disempowered and not really feeling like you have your mojo still. So there are so many different things that you can do for this. I like to just start really simply with ABC. And the first one is just um, allowing yourself an awareness. Just really start noticing what is happening. What are you feeling in your body? What are the sensations that are happening? What are the thoughts that are coming into your mind? What sort of behaviors are you doing? Like, are you noticing you're doing things differently because of everything that's going on? And what are you feeling? What are the emotions that are coming out? And we can't really do anything about the things that are going on in our lives until we actually honor them by noticing them and taking stock of them. So once you do that, one of the best things that I know of, well, a couple things, but the B is just to breathe. And one of the things that I like to teach all of my clients is
Yes.
something I call stop, drop, and breathe. Because I always remember as a kid, remember stop, drop, and roll. Everybody remembers that for the fire drill. So stop, drop, and breathe is pretty simple. And it's really just to take that pause, to stop, notice what's going on, drop your shoulders, because when your stresses are happening, this is what's happening. So just drop them and take a breath, take that nice big belly breath. Just really allow yourself to change your focus. And I'm focusing on your breath and change your physiology. The two really great ways to change your state when you're just in that stress response in the moment. And then the C is for connect, because I think, maintaining those really nurturing relationships in your life, connecting with people who are going through something similar that can help you, not to commiserate with them, but to help lift you, to help encourage you. Important, connecting with your family, connecting with your friends, connecting with your team of people who's going to help you get through all of this. So that's just the ABC, aware, breath, connect. But of course, my all-time favorite thing is emotional freedom techniques, the tapping. And I think we have a few videos on that. And, the research on the tapping is amazing in terms of reducing cortisol levels in your body. So definitely something very simple that you can learn, available right at your fingertips. And I really encourage you to go watch that video. But when it comes right down to it, there are so many things you can do. Find your resources. What is it that brings you joy? What is it that, makes you feel grounded and centered? Maybe it's dancing around the kitchen. Maybe it's belting out a song in your car. Maybe it's having a cup of tea, taking a bath. It doesn't have to be a spa day, although it can be. That's a nice thing too. But all of these little self-care things that you can do. And it doesn't have to be everything. It has to just be something. It's not all or nothing. It's all or something. Just do something to get yourself started. And of course, if it's really interfering with your life, then talk to a coach, talk to a therapist, talk to somebody who can help you get moving in the right direction, finding your team, helping you to get your mojo back, to find your confidence again, that sort of thing. But really taking stock of what your resources are and taking advantage of these types of things. Yeah.
Yeah, you know what, Nance? Great tips, and you're right. And some of the simplest things, or things that are literally at our fingertips, are well based in evidence and science, and we're not talking about them. So I'm so excited because you're sharing a lot about tapping. We're getting feedback about people that are doing the tapping, and just you can sit and watch this panel. You can have all the tools in your toolbox, but there's one thing that I know to be true. If they sit and collect dust, and you don't put them into action, they don't work. And like you said, Nancy, so beautifully, it doesn't have to be all or nothing, but all or and something. And that's what we were hoping to accomplish today. This has been an amazing conversation. I know there's so much more we could talk about. So I just wanted to thank each and every one of you for coming on this Happy Hormones panel through the ages and stages of life. And we're just getting started. If you want to connect with any of these professionals, you just make sure we're going to tag this and make sure we give the contact information where you can reach out to them and see them personally. And of course, this is a call to action. We would love for you to come to our Happy Hormones Playground event that's going to be live, taking place in Georgetown, Ontario on May the 9th between 6 and 9 p.m. at the Himalayan Salt Cave in Georgetown. We have an interactive, educational, experiential night of learning and fun and community empowerment, but where we can put our hands on these things, where we can do the exercise, where we can go in the salt cave, where we can speak to professionals like the incredible panel that's here tonight, to really stock your toolbox, but most importantly, as Nancy said, to feel connected and supported so that you can become the CEO of your health. So thank you, ladies, all for coming tonight.
Thanks for having us, Mark.
Thanks for having us.
Thank you.
Fun. Thanks, everyone.
And I'm going to leave everybody with this thought. Remember that a healthy tomorrow begins with prevention today. What are you going to do to take control and help your hormones be happy? We hope this helped you. We'll see you all soon.
Thanks, Mark. Mark, I just so I can't come on the 9th. I'm not back till the 11th. Yeah. Thanks, Mark. Yeah, sorry. I'm in Florida from the 2nd to the 11th.